Hi everyone, my name is Sylvette Guitar and I'm a nurse consultant at the Nurses Association of New Brunswick. I am presenting a webinar on the standards of practice for registered nurses that was revised in 2019. This standards document was developed with a collaborative working group. NANB worked in collaboration with the following jurisdictions: Newfoundland and Labrador, Northwest Territories, Nunavut, and 15 to 20 minutes. In this webinar, well, first of all, we will briefly look at the guiding principles and important elements related to nursing practice. Then, we will look more closely at the 4 standards, and we will finish with the resource section on the NANB website, a new section that will help you understand and apply the new standards of practice. Let's look at the guiding principles. There are many, but here are a few. Apply to all registered nurses in all practice roles, including nurse practitioners. Provide guidance to assist registered nurses in their self-assessment as part of their continuing competence. May be used in conjunction with other resources to guide nursing practice, such as standards. So we have standards for documentation, medication administration, and nurse-client therapeutic relationship, the guidelines, position statements, and employer policies, and also guide decision-making for practice and when addressing professional practice issues. Please consult page 5 of the Standards of Practice for Registered Nurses to see the other guiding principles. What important elements are related to nursing practice? Well, as you can see in this figure, there are many. And the overarching circle is public trust and can be assured and maintained when registered nurses exercise judgment and practice according to all standards and documents represented in this figure to meet the client needs. So as you can see, there's legislation, bylaws and rules, standards of practice for registered nurses, and the code of ethics. You have standards, like I mentioned a little earlier, for documentation, medication administration, and nurse-client therapeutic relationship, position statements and guidelines, and also employer policies. And at the center of this figure is the client with their needs. And this is the focus of nursing practice, a therapeutic relationship between the registered nurse and the client is essential in providing safe, competent, compassionate, and ethical care. Let's now talk about Standard 1, responsibility and accountability. The registered nurse is responsible for practicing safely, competently, compassionately, and ethically, and is accountable to the client, public, employer, and profession. So here are the highlights of indicators under Standard 1. I will speak briefly to it. So regulatory and registration requirements, adhering to law, the code of ethics, the standards, as I mentioned, for documentation, medication administration, and nurse-client therapeutic relationship, and also employer policies. To accept the responsibility for actions, inactions, decisions, and conduct. It speaks about accountability, fitness to practice, duty to report, and advocacy for client safety, policies for quality nursing practice, and responsibility for continuous professional development. So the Continuing Competence Program, your CCP. Now let's look at a case study for Standard 1, and you will see that throughout the webinar, there will be a case study for each standard. And at the end of this webinar, I will show you where you can find other case studies related to each standard. And I will also relate every case study to an indicator in the standard, and then ask a question and provide an answer. So for this one, well, Julie works full-time as a registered nurse in the OR. She is married with 2 children under 4. 3 months ago, her partner was diagnosed with end-stage cancer. She is holding the family together while working as long as she can before he becomes really sick. Her colleagues noticed lately, though, that she has made several mistakes at work. They are now worried that clients are at risk. And this case study relates to indicator 1.7 that says, recognizes and addresses violations of practice, incompetence, professional misconduct, conduct unbecoming the profession, and or incapacity of nurses and or other healthcare providers, and complies with duty to report. And the question is, what should Julie's coworkers do about their concerns that Julie may be putting clients at risk because of her difficult personal circumstances? Well, the answer is that her coworkers can offer their support, but need to ensure client safety is not at risk. And that is the most important thing. Well, client safety has to be the most important thing here in this situation. They will discuss the professional practice issue with their manager. Also, the manager needs to make sure Julie is fit to practice by monitoring the situation, referring her to resources such as employee assistance program or occupational health, and supporting Julie as much as possible. Let's continue with Standard 2, Knowledge-Based Practice. The registered nurse practices using evidence-informed knowledge, skill, and judgment. So what are the highlights under indicators for Standard 2? Well, there's critical inquiry, plan of care, so establishes initial plan of care and monitors its effectiveness. Competence, reasonable judgment. Evidence-informed practices speaks also about assigning and delegating, preceptorship and mentorship, documentation, and the use of new knowledge and technology. So here is the case study for Standard 2. Margie, a registered nurse who works on a med-surg unit in a small community hospital, is a preceptor for Jessica, a recently hired licensed practical nurse. 3 of their clients have just been discharged, and they will be receiving a new admission as soon as the bed is ready. So looking at the indicators, this one relates to 2.3. Monitors the effectiveness of the plan of care and revises the plan as needed in collaboration with the client and the healthcare team. And the question is, how could Margie and Jessica work together to monitor the effectiveness of the plan of care and revise as needed? Well, the answer is the RN and the LPN need to understand each other's scope of practice. This is very important to know what they can and cannot do. They can then collaborate to maximize efficiency when completing client care and developing the new client's plan of care. Although it is Margie's accountability as the RN to interpret the information gathered and develop the plan of care, there are many ways that Jessica can contribute to this process. So if Jessica is collecting information after an assessment, she will share that information with the RN, and then that will help elaborate the plan of care. So that's the way that they can collaborate together. Let's look at Standard 3, Client-Centered Practice. The registered nurse contributes to and promotes measures that optimize positive client outcomes at the individual, organizational, and system level. The highlights of indicators under Standard 3 are professional presence and behavior, effective, respectful communication with client, therapeutic nurse-client relationship, privacy and confidentiality, client-centered practice, also speaks about support clients in self-management of their health, speaks about collaboration, advocacy for clients' dignity, right to informed decision making and informed consent, and the respect of diversity and cultural competence. So here is the case study for Standard 3. Karen, a registered nurse, works in a long-term care. She has become closer to Esther, a client who recently celebrated her 95th birthday. During a celebration, Karen asked Esther's daughter if she could take a picture with her cell phone. Esther's daughter said that would be fine. Later that day, Karen posted the picture to her Facebook page with a caption, "So happy I work with special people like this." Karen's profile identifies her as an RN who works at Shady Lane Nursing Home. Well, looking at this case study, it relates to indicator 3.4, upholds and protects clients' privacy and confidentiality in all forms of communication, included but not limited to e-records, verbal, written, and social media. And the question is, has Karen violated any standard 3 indicators? Well, your answer is probably yes, just looking at the situation. So which one did she violate it? So there's 3.1 that speaks about models professional behavior, 3.3 therapeutic nurse-client relationship, and 3.4 privacy and confidentiality. And maybe if you look at the indicators, you would find other ones that she violated. But those are the three that we pulled out. And we want to say also that whoever becomes aware of comments or situation like this on social media, well, they have a duty to report. Let's continue with Standard 4, Professional Relationships and Leadership. This is a new standard. It wasn't in the 2012 version of the Standards of Practice. And it says, the registered nurse establishes professional relationships and demonstrate leadership to deliver quality nursing and healthcare services. And the highlight of indicators under Standard 4 are, well, of course, leadership, utilization of resources for effective and efficient care, effective and respectful communication with team members, advocacy for healthy public policy, population health, advancing the profession, independent collaborative practice and respect of scopes of practice, communicates RN's role. So the RN is able to communicate her role within the healthcare team, and advocacy for quality professional practice environments. Let's now look at the case study for Standard 4. Rachel, a nurse practitioner, and Patsy, a registered nurse, work in a busy primary care clinic. Their manager, Joelle, also an RN, has decided to add another staff person to address workload issues. After completing a job analysis, she decided a licensed practical nurse would be the best fit. So looking at the indicators, well, this case study relates to indicator 4.7. Practices both independently and in collaboration with members of the healthcare team while understanding and respecting other team members' scope of practice and contributions in the delivery of safe, competent, compassionate, and ethical care. And the question is, how will Rachel and Patsy ensure there is collaboration between members of the healthcare team while respecting other team members' scope of practice and contributions in the delivery of care? Well, the answer is respecting and seeking to understand the LPN scope of practice. So maybe if they have questions, they can call the regulatory body of the LPNs or ask other members of the healthcare team. Facilitating a staff meeting to discuss how they can work collaboratively as a team that Joelle will coordinate and oversee, and creating and maintaining a safe and respectful environment for all. And you are maybe thinking of other things that could be done, and that's okay. Those are the ones that we pointed out for this case study. Let's now look at a very helpful tool. NANB has created a section on their website with several resources for the standards of practice for registered nurses. So like you see on the screen, you click on nursing practice and then nursing standard, and you will see the logo of the standards of practice appear. So in this section, you will have access to information on the 4 standards and on other important documents like the Code of Ethics for Registered Nurses, information regarding registered nurses and then nurse practitioners, and the additional standards for our Ns and NPs called medication administration, documentation, and therapeutic nurse-client relationship. So you would find this information if you click on Standard 1. So you will find FAQs, case studies, quizzes, and several other helpful resources. And this is really the same format for the other standards. So we strongly encourage you to consult the resources for each standard, read the case studies, and take the quiz. If you have any questions related to the application of the standards of practice in your practice, or for any other questions related to your practice, please contact NANB at the following contact information. And I thank you sincerely for your attention during this webinar.